tested, 44,000 Virginians, but the Johns Hopkins data that per 100,000 or some metric that normalizes for population, that we are amongst the lowest. And that's something we're addressing. We are trying to understand how do we optimize the capacity we have, whether it's in the state lab or academic labs, as well as in commercial labs. Also, we've been in touch with our provider community. What I've learned is that many of our providers who, unless it's going to influence where folks are cared for, namely in the hospital, often they think that they can, and rightly, care for patients with COVID-19 on a practical basis, with presuming that they have it. But from an epidemiological point of view, there's many advantages to have more people tested. So I think that we need to, as the state, through our developing a task force, which will have more be able to report out in the days ahead, is looking at that capacity, how to synchronize that with the criteria that we use. Right now, we've got across the nation, there's 3 categories from the CDC. There's the Group 1, the Group 2, and Group 3, and we have been focusing on those that are hospitalized and those that have healthcare workers with symptoms. We've expanded that to include, and this is work from the health department together with the state lab, focus on those within the long-term care facilities, and that's where we've focused additional testing capacity to make sure that when there was an outbreak, whether it was coming from the state lab or from UVA or from the VCU lab or other academic labs around the state, that capacity was there. What we are evaluating now is how to make sure that that we broaden that testing criteria with our clinical community so that we can have more testing and a better sense of where this is happening. And there's 2 real goals. One is outbreak intervention that Dr. Filano has discussed. The second is how our providers, that's the nurse practitioners, our doctors, the PAs that are caring for patients one at a time, and then also our public health surveillance to make sure that we have the right capacity for those different missions. And clearly we need more testing available here in Virginia. So I think we certainly understand that data, and we know that it needs to be improved, and I've outlined how we're going to go about improving it. So thank you.